And welcome back to the Healthy Zone. We're focusing on kids' health this week. And right now we're going to discuss back pain in children, which is not like back pain in adults. Compared to an adult, a child with a backache is more likely to have serious underlying disorders. This is especially true if the child is 4 years old or younger. Also, in grade school age children, wearing a backpack really is a problem for kids. Well, 70 to 85% of all people, no matter what their age, will complain about back pain. If you're one of the tens of millions of Americans that suffer with back pain, you know firsthand how this affects your life and your family. Now, we have two physicians with us today who are going to talk to us about back health and how to evaluate the latest options for relief of back pain. Joining me now is Dr. Charles Rosen, the clinical professor of orthopedic surgery at the University of California and the president and co-founder of the Association for Medical Ethics. Also, Dr. Cynthia Ambrose, the senior vice president, chief medical officer at Blue Cross Blue Shield of Western New York. Thank you both for being here. I appreciate it.
Thank you so much for having us.
You know, there's so many things we can talk about in back pain. So let's start with children and back pain. Dr. Ambrose, how do we know if something that a child is complaining about with their back is serious?
Well, it's interesting, and I'm going to let Chuck just quickly address the scoliosis issue, which is the thing I think parents are concerned about.
Yeah, I know a lot about scoliosis.
Yeah, but I think we're seeing an increasing thing in something that's preventable, and I wanted to mention that. You know, the backpack issue, which you mentioned. A child should not be carrying a backpack that's heavier than 10% of their body weight.
Okay.
So you see them with these great big things on, you know, struggling almost to go to school. I see kids in the airport with big backpacks also pulling rolling bags because that's become sort of a neat thing, a trendy thing to do. And we have to be very watchful of those kinds of things because, you know, they can really cause serious back injury in kids. The other thing is anything sports that cause repeated extension of the back. So gymnastics, football, you have to be careful. If a child is starting to complain about back pain and they're involved in those kinds of sports, they should be evaluated because it can cause a stress fracture.
How do you know when to, because it's not a normal thing for a child to complain of back pain, is it?
Yeah.
No, it's not normal to complain of back pain if you're a child. Certainly if some child that's a toddler complains of pain or it looks like they're walking funny or stiff or have fevers, or they're teenagers and they're having pain in their back, then you have to take it seriously. The time that it doesn't hurt that you have to look out for is scoliosis. If you see a child from early teens or even before is walking a little funny, one shoulder's higher than the other, one hip's a little higher than the other, walking a little sideways, but doesn't hurt, you have to think that that possibly is scoliosis, and they should get checked by their doctor. Because if you treat that sort of thing with a brace early on, then you may not need any surgery ever.
And with scoliosis, is that the school nurse checkup or the pediatrician checkup where they bend over and they look at the spine and kind of check all their...
Yes, that's exactly that. That's the school screening, and it's been shown in numerous studies to avoid surgery later on and to, if need be, lead to brace treatment, which is non-operative care, which is better.
And what's the most common cause of back pain with adults, from children to adults?
Well, the peak age from 20 to 40 is the peak age for tearing the outside of the disc, which is the cushion between the vertebra. When you twist, you're out of shape, you bend, you twist, you're a weekend golfer, gardener, and you tear the outside of that disc, you get a lot of inflammation, the nerves get irritated, you get in spasm for 2 or 3 days, and that's the most common cause. And 95% goes away within 4 to 7 days with just some Advil or Motrin and some rest. 95%.
How much does a person's weight affect whether or not they're getting back pain? Is that a big problem? Dr. Ambrose, I heard you
Well, weight affects everything, and certainly with back pain. For example, if you're a guy and you have this big beer belly there, you got to realize that's about 5 or 6 inches away from the spine, and it has kind of a lever arm. So every pound you add on your belly, you got to realize you're adding 6 or 7 pounds and pulling your spine forward constantly, giving it a stress that shouldn't be there, whereas you should be up with an arch. So it's bad for back pain.
Okay, and we'll stop there for now. We've got more to talk about with back pain and so much more. Coming up, we're back with Dr. Rosen and Dr. Ambrose to discuss evidence-based medicine, so please stay with us. How appropriate as I say welcome back, because we're talking about back pain, and we're still talking with Dr. Charles Rosen and Dr. Cynthia Ambrose. Thank you both for being here. I want to just finish our conversation. We were talking about back pain. What are your feelings on back surgery?
Well, most of back surgery, I think, in this country is really not necessary because a majority of it seems to be done for just a degenerated dark disc on MRI scan, which in 70% of adults is there without any back pain at all and is a normal part of aging. There is no evidence that operating on just a degenerated black disc does anything better than being in shape. Now, there are certain things like fractures, instability, certain technical things that need to have an operation,
Sure.
but not just a degenerated disc. And that's the vast majority of abuse in this country.
Okay, so people need to be careful about making that decision.
Oh, absolutely.
Yeah, yeah. Now, you're also, Dr. Rosen, the president and co-founder of the Association for Medical Ethics. And tell us how you started this organization.
The Association for Medical Ethics promotes, well, let me put it this way. When you go to your doctor, you'll get a prescription for a drug, or you may get a procedure that you should have done with something put in your body, and you really don't know, nor does the doctor, how much the researchers that did that study were paid by the company that made that device or that pill. And that's really critical because it's almost all the time a little less than objective for treatment. The Association for Medical Ethics promotes disclosure, financial disclosure of how much doctors, researchers are paid by companies, so doctors and patients can know. And so that's why we testified in front of Congress for the Physician Payment Sunshine Act, which fortunately passed and just requires all companies to reveal that information to the public. That's what AME is about.
And so the more we know, the better decisions we can make.
Exactly.
Okay.
Absolutely. That's exactly the reason.
And Dr. Ambrose, evidence-based medicine approach, how does that help to make decisions about what a health care plan will be?
Well, for us, it's very important for there to be, a transparency for the patients and for the physicians. Very often, a primary care physician is recommending a certain procedure or such, and they don't know the information that Chuck just described, and they also don't have all of the information that we think is necessary to make a really informed decision. So what we're trying to do is work with the physicians and work with the primary care physicians to make sure that both they and the physician have all the information, so that we know that there's certain research that is what we call evidence-based. And those are studies that have been done, large studies that have control groups, groups that did not have the procedure done. So you can see, did it really make a difference?
Right.
Because right now, if you're just going on perhaps maybe someone's professional opinion, they are promoting a certain procedure that they might do themselves or that they think has a very good outcome. But the evidence, longitudinally, if you look at it over hundreds of or thousands of people, may not have made a real difference in the outcome. So you can say as a patient, if I have the procedure or I don't have the procedure, is my outcome going to be better or worse? If we knew the outcome was the same, everyone would vote not to have the procedure.
Right, exactly, because there's so many, it's like the trickle-down theory. All right, so let's get back to health of our back. For children to grow up and have a healthy back, what would both of your advice be? Start with you, Dr. Rosen.
Well, I think for children and adults, the healthy back is to be active, just like the sequence before you had with the kids running around. To be active, to use their bodies, to develop their balance, and to live a healthy lifestyle, which means not getting overweight.
Right, and the
being
childhood
active.
obesity problem is such a huge problem in this country.
Right. And so being active and leading a healthy lifestyle and not being overweight, that's probably the biggest sole thing for children and adults to do to avoid back pain.
Okay,
Like our
Dr.
mothers
Ambrose?
used to say, we are what we eat.
Right.
So diet is extremely important, and it cannot be underestimated in all of our health. We are one. Our back is part of our body. So the health of our entire body, earlier Dr. Rosen talked about, being overweight and how that affects the back. The way you eat affects the entire body. So we have to be thinking about our health as in a holistic way, and making sure we get that exercise because we're becoming a pretty sedentary population.
Well, and on the show, we try to tie it all in because I think so much of the time we think how we're feeling, how our health is, how our body feels is so separate than what we're eating, and there's consequences to everything, and there's good things too. Where can we find more information about your work?
www.
Facebook.
haven't quite made to Facebook. Ethicaldoctor.org.
Okay, and also bcbswny.com.
Blue Cross Blue Shield of Western New York.
Thank you both so much for being here, and hopefully here's to everybody having healthy backs for sure.
Yeah.
Thanks for joining us.
Oh,
Appreciate
thanks.
it.